Hello, good afternoon, everyone. My name is Dr. Randa Youssef, and today we will be discussing a very important station in NAC OSCE, which is febrile seizure. This station actually includes two parts. One part would be the history taking, and the other part would be the counseling. So hopefully by the end of the presentation, you will be able to tackle this station successfully. So let's get started. So let's start with the history. In this scenario, you will be encountered with a parent whose child has experienced febrile seizure and brought him to the hospital. First thing you would like to do is assuring the parent that the child is taken care of by other team members and show some empathy because this is a really traumatic event for the parent as well. Then you can go over a brief history of what happened. We would like to start first by analyzing the event, and to make it easy to memorize, you can go before, during, and after. So what was the child doing before the seizure started? And then when the seizure happened, for how long it lasted? And was it generalized or one part of the body? Because febrile seizure usually is generalized. After that, you would like to know if the child has lost conscious and any other changes that the parent would like to share. And we will move that after that, what happened after the seizure, like was the child able to recognize his surrounding, how about his level of conscious, and any loss of his bladder control or bowel motion, and any injury that happened because of the seizure, like if he hit his head on a hard surface. After that, you would like to inquire. By now, most probably there would be the parent would have mentioned something about a fever, so you would like to know about the fever as well, how high it went, and if it was measured or not, any medication was provided to the child. Having fever, you would like to explore what is the source of the fever. So you would like to ask questions from head to toe to explore all systems of the body. And it's very important to show that you are ruling out life-threatening conditions like meningitis. You would like also to rule out pneumonia. Of course, that might need some investigations in the hospital, but you would like to basically ask about all systems. After that, you would like to go over brief pediatric history. Most probably all of you by now are aware of the BINDI, which is the acronyms for the pediatric history. So B stands for birth. You would like to go like if vaginal C-section, any complications, any ICU admissions after delivery for the child, and then explore a little bit about the immunization. It's important here also, some of them, the vaccines might cause fever that might lead to febrile seizure. MMR vaccine is one of them, so it's a nice idea to explore vaccination in this history. Then you would like, of course, explore the nutrition of the child, any issues with the development, and in each pediatric station, we would like always to rule out child abuse. That's why we ask about the environment, who's living with the child, any smoking, parents, siblings. So always keep it in your mind when you are doing any pediatric station to rule out child abuse. Then if there was any issue in the past, any medical condition in the past, and quickly go over the family history, because in febrile seizure, there might be a positive family history for febrile seizure, but you would like also to rule out any epilepsy condition in the family. So let's move to the counseling part of the station. After taking the history, we have gathered information that shows the most probable cause of the child seizure is febrile seizure. So we would like to start by showing empathy, as I mentioned before. Then we would like to know if the parent has any idea about what is febrile seizure. If they don't have an idea, we would like to talk about it and educate them and share the benign origin of this medical condition. Important points to mention here in the counseling. Assure the caregiver that febrile seizure does not cause brain damage, because this is the most concerning part for parents. They are scared that this seizure might cause damage to the brain. So assure them that it is a benign condition that happens in a specific age group. Usually it's between 6 months to 6 years. Then children, as they grow, they outgrow of it. And the reason for the febrile seizure is that children's brain cannot tolerate high fever. That's why it's more susceptible for fever. And we would like to let them know that this condition is self-limited. Children will outgrow of it as they grow up. It's a good idea to let them know what is the typical attack looks like, so they have an idea if something went wrong. We would like to let them know that it is usually less than 15 minutes and it does not reoccur in 24 hours, and it is generalized, as we mentioned before. So while counseling the parent, you will expect some questions. So that the parent might interrupt you and ask you, is my child going to have another attack? It's a good idea here to have some numbers in mind in case of the parent asks you these questions, because it shows that you have some stats you can share with your patients. So you might mention that children will not have it again in 65% of the cases, while 30 to 33% of children will have another attack. But most of these are benign, and only 2% of those children will develop seizure disorder. This seizure has happened. What about in future? You would like to emphasize to the parent that the best treatment for febrile seizure is preventing it from happening. By that we mean, if the child develops any fever in future, it's very important to seek medical attention, because we need to know the source of the fever and treat it accordingly. There are some few steps that caregivers can do as well at home to reduce the risk of febrile seizure by using medication like Tylenol, Advil, to reduce the fever. Take care of the hydration of the child and use some cold foments that will reduce the fever. But that might not help and the febrile seizure might happen again. So what would we recommend? In this case, we would recommend that the caregiver keep calm and protect the head and the airway of the child by turning the child on the side, and protect his head by putting some soft cushions around him. Bring the child to the ER if there is a possibility, and if the child was at high risk for recurrence or prolonged seizure, it's a good idea to keep some rectal or sublingual lorazepam at home. By the end of the discussion, we might provide some brochures, websites for the parent also to have some further information. We might share with them some support groups as well to share their experiences, and we would like to make sure that the parent understood the counseling, like if they have any questions they want to ask or anything they didn't understand well, so we can go over again with them. In this last slide, I put together some important points in this station. The first one is about inquiring about recent vaccines. As I mentioned before, MMR vaccine might be the source of the fever and consequently the febrile seizure. The second point is administration of antipyretic medications might not help in preventing febrile seizure if the child is susceptible. But that's just to keep in mind. You don't need to tell the parent about that point. Empathy is important in this station. And it's very important to rule out child abuse in every pediatric station. By that, we come to the end of the station. I hope now you have a better approach to tackle this station. And I wish you all success, and I am sure you will be doing great in your NAC exam. Good luck and have a good day. Thank you.